Okay, let's talk about two absolutely massive issues: chronic pain and mental illness. We usually think of them as totally separate problems, right? One's in your body, the other's in your mind. But what if? What if that's completely wrong? What if they're actually locked together in a way we're only just beginning to understand? First, just to get a sense of the scale we're dealing with, get this: 25%. That's roughly the chunk of the entire world's population that suffers from chronic pain. So look around you. 1 in every 4 people you know is dealing with this. It's a huge reason for disability and for doctor's visits all over the planet. And just so we're all on the same page, let's be super clear about what chronic pain actually is. We're not talking about a temporary ache that goes away. The official definition is pain that sticks around or keeps coming back for more than 3 months. And here's the key: it's now seen as its own disease, not just a symptom of something else. So here's the game plan for this explainer. First, we'll unpack this idea of a vicious cycle. Then we'll dig into the massive scientific review that proves it. We'll see how pain shows up across different mental health disorders, ask why they're so connected, look at the big gaps in treatment, and then land on the single biggest takeaway from all of it. All right, let's get to the heart of it. For decades, you'd go to one doctor for your back pain and a totally different specialist for your anxiety. But the evidence is now screaming that these things are deeply intertwined, caught in a vicious cycle. And this is really the central question, isn't it? What if the pain is feeding the mental distress, and the mental distress is turning up the volume on the pain? If that's true, it changes everything about how we should be helping the millions of people who are caught in the middle. Now, the information we're talking about today comes from a huge new study called an umbrella review. You can think of it as a review of other reviews. They basically hoovered up all the best, highest quality evidence out there to give us the clearest possible picture. And the scale of it? Well, it's just incredible. Get ready for this number. The researchers brought together findings from studies that included a grand total of over 17.5 million people. Yeah, this is not some small one-off study. This is a top-tier global look at the data, which means the conclusions carry a ton of weight. And what they found is absolutely staggering. Okay, remember that 25% number for the general population? Well, look at this. In people with PTSD, the rate of chronic pain can be as high as 96%. 96. That's not an increase. It's nearly universal. It's almost a given. And listen, this isn't just about PTSD. That was just the most jaw-dropping example. As the scientists kept digging, this link between pain and mental health just kept popping up, again and again across a whole bunch of different disorders. The pattern is impossible to ignore. So for depression, you see pain in up to 65% of people, and it's a two-way street. The pain can contribute to depression, and the depression can contribute to the pain. For bipolar disorder, it's over 60%, and having the disorder literally more than doubles your risk of chronic pain. Even with schizophrenia, it's nearly 50%, a huge extra burden for a group that's already vulnerable. Okay, so we've nailed down the what. The connection is real, it's strong. So the next big question is why? What's actually going on in our bodies and brains that locks these two things together so tightly? The whole cycle really boils down to 2 steps that endlessly feed each other. Step 1 starts with the body. Living with constant pain is, incredibly stressful. It naturally creates anxiety and distress. But then comes step 2, where the mind reacts. Those mental health conditions can actually rewire the brain, making you more sensitive to pain signals and less able to tolerate them. So on one side, the pain can make you feel depressed, isolated, and anxious. But then on the flip side, a distressed mind not only lowers your pain threshold, it can also trigger something called pain catastrophizing. That's basically a negative mental loop where you fixate on the pain and feel helpless, which, you guessed it, makes the pain feel even worse. It is a perfect, terrible feedback loop. The research also pointed out some common factors that can make a person more likely to get caught in this cycle. Things like being female, being older, or facing financial hardship. And, not surprisingly, having more severe mental health symptoms to begin with is a big one. Even lifestyle stuff like insomnia or not moving around much can really increase the risk. So that brings us to the most important question of all. If we know they're so connected, what in the world can we do about it? And this is where the review found a really big problem. There's a huge gap in our ability to treat these things together. Now, they did find some treatments that look promising. Things like cognitive behavioral therapy, or CBT, seem to help. Body-based practices like yoga and Tai Chi show real benefits too. There are even some high-tech approaches using brain stimulation that show promise. But the key word here is limited. The overall evidence is still pretty thin, and we don't have a clear winner for what works best. And that gap in treatment leads to a really dangerous reality. Because when you don't have clear, effective alternatives, the default option too often becomes opioids. And the numbers are just stark. For patients who have both bipolar disorder and chronic pain, a staggering 45.5%, almost half, are being prescribed opioids. And this brings us right to the main conclusion from the scientists themselves. I want to read this directly from their paper because it's so important. They say, this work highlights an urgent need for integrated psychiatric care approaches, emphasizing that addressing chronic pain could enhance mental health outcomes and overall patient well-being. So after all that data, what's the single most important message we can take away from this? Well, it all boils down to a fundamental change in how we see things. We have to start treating the whole person. The message from the data on 17 million people is absolutely unmistakable. You just can't treat these things in separate boxes anymore. Trying to treat someone's depression while ignoring their chronic pain is a recipe for failure. And trying to treat their pain while ignoring their mental health is just as bad. They're two sides of the exact same coin. Which leaves us with one last, pretty big question to think about. If the evidence is this overwhelming that the mind and body are so deeply connected, why is our healthcare system still so insistent on treating them like they're total strangers?